So let's take a look at the dental therapist. For starters, is that a thing? And who are they? Well, what do they do? Why do we need them? And where did they come from? Let's find out. Let's start with the history of the dental therapist. In the 1950s, therapists began when there was a desperate shortage of dentists in the UK. In 1960, the first school for training opened up, and they were then known as dental auxiliaries. They could do simple restorations, deciduous teeth extractions, and provide radiographs and scaling. In 2004, the first therapy degree course commenced in Scotland. But what else can they do? Well, the dental therapist can carry out clinical examination within their own competence, obtain a detailed dental history from patients and evaluate their medical history. They can diagnose and treatment plan within their competence. They can give appropriate patient advice, carry out oral cancer screening, if necessary refer patients to other healthcare professionals, keep full, accurate and contemporaneous patient records, identify anatomical features recognising abnormalities and interpret common pathology, and if working on prescription, vary the detail but not the direction of the prescription according to the patient needs. But can a dental therapist take radiographs? Yes, a dental therapist can prescribe radiographs, take, process and interpret various film views used in general dental practice, such as OPT, periapical and bite wing radiographs. Can the dental therapist use analgesia? Yes, the dental therapist can give infiltration and inferior dental block analgesia. This has been in place since 2002. Can the dental therapist carry out restorations? Yes. The dental therapist can place temporary dressings and re-cement crowns with temporary cement, place rubber dam. They can also carry out direct restorations on primary and secondary teeth. Can a dental therapist work with paediatric patients? Yes. Dental therapists can place preformed crowns on primary teeth, they can extract primary teeth, and they can also carry out pulpotomies on primary teeth. What about prevention? Yes, dental therapists can provide preventive oral care for patients and liaise with dentists. They can give patients advice on how to stop smoking or refer to a smoking martyrs clinic for further help and guidance. A dental therapist can give detailed nutritional analysis to help patients better understand how their diet can affect their health, including alcohol awareness, and also give detailed prevention so that the patient can effectively manage their oral health at home. This includes the use of interdental aids such as floss, interdental brushes, single tufted brushes, toothbrush instruction, and to help sort out their oral health regime at home. What about hygiene? Yes, the dental therapist can complete periodontal examination and charting and using indices to screen and monitor periodontal disease. They can also undertake supra and subgingival scaling and root surface debridement using manual and powered instruments, using antimicrobial therapy to manage plaque and related diseases, adjust restored surfaces in relation to periodontal treatment, and apply topical treatments and fissure sealants. What else can a therapist do? Well, a therapist can take intra and extra oral radiographs, and under extra care and learning can carry out whitening, inhalation sedation, and remove sutures after wounds have been checked by a dentist. Now, let's take a look at some of the things that a dental therapist cannot do. A dental therapist cannot carry out anything that involves laboratory work, such as dentures, crowns, bridges, or implants. However, they can care for implants and treatment of peri-implant tissues. They cannot carry out root treatments or extract adult dentition. So, now let's take a look at where the dental therapist works. Well, the dental therapist can work in a number of places. How does the dentist work? The dental therapist work? The dental therapist works privately. They can work under the NHS, where they are a band 6. They can work under prescription from a general dental practitioner or a dentist. They can own their own practice, however they still have to maintain their own work. They can carry out domiciliary treatment, attending patients who cannot make it to practice. They can tutor students. They can become VT trainers for recently qualified dental therapy students in practice. They can work under the public dental service. They can work in general practice, which could be both mixed and private, NHS, and they can work under direct access without the prescription of a dentist. Now, let's look at some oral health national programmes in Scotland. The first programme we should look at is Child Smile, which is a national programme that is designed to improve the oral health of children in Scotland. It promotes a holistic approach to healthy living, teaching children an important life skill in maintaining their oral health. It delivers a range of preventive care interventions for children from nursery, aged 2 years, until they leave primary school, who are at an increased risk of dental disease. Fluoride varnish is applied twice yearly, as well as checkups twice yearly in priority nurseries and schools in each of the health boards. Dental health support workers are responsible for liaising with families, health visiting teams, nurseries, schools, and dental practices. Since it began, in 2017, 77% of primary 7 children had no decay experience, compared to that of 42% in 1988. This shows that Child Smile is an effective programme and is working in Scotland to improve the oral health and the childhood caries reduction across Scotland. Another programme in Scotland is the Smile for Life programme, which aims to help homeless people maintain their oral health effectively. Another programme is the Caring for Smiles programme, which aims to improve the oral health of older people, particularly those living in care homes. The training has been developed for care staff, nursing home, oral health champions and care home managers in providing basic training sessions to improve the delivery of oral care for elderly people who may suffer or reject treatment and care, often as a result of dementia or lack of manual dexterity. There are a number of people who are valuable in delivering the oral health care of patients, such as dentists, dental nurses, dental hygienists, dental therapists, oral surgeons, receptionists, dental support workers, care staff, health visitors, doctors, support workers, tutors, and students, who all make up the dental team and are responsible for looking after patients. So, as a quick recap, is it a thing? Who are they? What do they do? Why do we need them? And where did they come from? Well, they are dental therapists. And in a nutshell, now you know.